Assalamu alaikum everyone. Today I would like to welcome all of you in a new session of the career counseling. Today we got a very special guest with us, who is also a mentor and inspiration for all of our young ophthalmologists of the Pakistan. Sir, welcome, Dr. Umer Kidwai with us tonight.
Thank you for the invitation. It's my pleasure to be part of this webinar.
Sir, it's our honor to have you. Sir, before starting your introduction, I would like you to please introduce yourself and tell us about your life journey and experiences and challenges that you have gone through and achievements.
Thank you so much. First of all, I don't think so. We fulfill the purpose of life in any ways, but we always have to try and fulfill the life for which we were made for. And that's the primary purpose. But we have to live life in this world, and in order to have a reasonable life, we have to do lots of things. Okay, so let's come to the real topic, which is career counseling. This is more of a philosophical thing, anyways. So I think the first thing is, yeah, I graduated from Dow Medical College in 2005. Did my house job in civil hospital afterwards, and started appearing in Part 1 exams in 2006-ish, 7-ish. Alhamdulillah, passed all in one go, and then started my residency. I did my training in Al Ibrahim Eye Hospital, which was considered one of the finest training hospital at that time in Sindh. While I was doing my training, I had this mentality that I need to go abroad, and probably leave Pakistan forever, like typical youngsters in your graduate school. So when I was doing my residency, I had this objective that when I finish off my postgraduate degrees or fellowships, I'll soon leave Pakistan forever. And that's why I was giving all the international exams simultaneously, like refraction exam of One Royal College when I was giving IMM module for the College of Physicians and Surgeons, and so on and so forth. So by the time I finished my part 2, within a year or so, I did my FRCS as well, and other exams related to International Council of Ophthalmology. And on the basis of doing FRCS, you get registration in UK. You still have to pass your English competency exam. So immediately after doing so, I started applying for jobs in UK, and alhamdulillah, got a job afterwards. And in between, I also did a small fellowship, which is an ICO fellowship in Australia for 3 months, which is again an opportunity that many can avail, especially working in Pakistan. So I'll come back to this point about this
Yes,
ICO fellowship, but I started my work in UK in 2014. Initially did my fellowship in ocular plastics for a year and a half, and then started working as a general ophthalmologist in order to pursue a competency pathway, which is necessary to become a consultant. I finished that pathway in about 5 years, and then I got a license to work as a consultant in UK. After that, I did my fellowship in glaucoma, adult glaucoma, modern glaucoma fellowship, anterior segment fellowship. And then, this is where the philosophy matters more than the thought of working in a real life. You never know what you can plan. Actually, you can't plan a thing. This is what Allah subhanahu wa ta'ala has given us, that you don't have any authority on yourself. So at that point, when I thought, okay, I'm going to stay here, I'm going to buy a house and something like that, I had some family issues, and then I had to move. I decided to relocate to Pakistan. That's also for the will of Allah subhanahu wa ta'ala.
yes, sir.
By the will of Allah subhanahu wa ta'ala.
Exactly.
And,
Yes, sir. Please.
and then, so this is the thing. So you can't plan your journey,
Exactly.
but that's how it happened. And I ended up back again in Pakistan. I'm working as a full-time consultant here
Yes.
since 2.5 years, last 2.5 years as a glaucoma specialist. Alhamdulillah, no regrets. What's really important is there are lots of things that we don't see when we are achieving them, and we cry on our losses more than the achievements that we do. So alhamdulillah, lots of achievements in this pathway, and we should be thankful to Allah subhanahu wa ta'ala for every achievement.
Indeed, sir. So you told us about while in training in FCPS residency in Pakistan, you have given some foreign exams. So you did the exam of ICO, or you have given the exam of FRCS ophthalmology?
No, I didn't do the FRCO of ophthalmology while in Pakistan. The problem is the FRCO of ophthalmology exam is very expensive, number one. And number two is they don't have, 10 years down the line, they didn't have many centers, or hardly any center outside UK. So in order to give 4 exams. For every exam, you have to go to UK and get a visa, and the exams are really expensive. It's very difficult for somebody working in or studying in Pakistan. Um, but that's why everyone preferred the route of FRCS, because at that point, even lots of FRCS centers were available. You don't even need to go to for any part in the UK. You can go through all the parts somewhere outside UK, like Egypt or Jordan or anywhere, etc. They
Uh,
keep changing the center.
so, sir,
So at that, yeah.
so you have given ICU exam during FCPS training?
So I at the time of at my time, the rules changed quite a lot, and the exams changed as well. So at my time, I was giving ICU exams because ICU used to give exemption to FRCS Glasgow, and there was a new format, FRCS Edinburgh exams started at that time as well, in something around 2007ish. Um, so I started giving their exams as well, and they used to have 4 exams at that time. Their format has now changed altogether.
Yes, sir.
This is not the same format.
Exactly.
So at that time they used to have four exams, and if you pass 3 of them, you get MRCS Edinburgh. And that was still and lots of kids I know, they did FRCS at Edinburgh and left Pakistan to work in the UK because they used to grant registration with MRCS Edinburgh. I'm not sure they still do it now, but that was the case. But they are not doing exams anymore on MRCS or Edinburgh now. But now they've got collaboration with ICU, as far as I know.
Yes.
Uh, so if somebody passes the ICU exam, they also get exemption from MRCS Edinburgh. So that's very good now. Previously, it used to be only for Glasgow, but now it's for Edinburgh as well. So when you are quite motivated when you're thinking, oh, I'll do all the exams and things like that. But realistically, the exams are very, very expensive, especially now, because of the conversion rate in the currencies. It's going to be really expensive exams because they still cost a lot. The fees are increased, and if you convert the from rupee to GBP, it's quite a lot of money. So when I passed, I first passed the MRC. I didn't get the date for MRCS Edinburgh, the OSCE exams, and somehow got the date in the FRCS exam, and I sat in the exam and passed it. Um, then I was thinking about sitting in the MRCS Edinburgh exam, but I didn't have enough money, to be honest, to avail for that exam. And honestly, I felt like I'm not going to make it. It's not going to make any difference for me if I have two fellowships instead of one. So I just stuck with one exam. But in UK, when I went in UK, I'd gone through the FRC of the exams because it's much easier to give the exams when you're working in system, and the centers are in UK, and you can easily go and sit the exam. You don't need to spend money on commuting from one country to other and things like that. So it's much easier to give FRC of when you are working in UK, but it's very difficult to give FRC of when you're not working in UK. Um, um, and that's what I did. That's why I did the FRC's Glasgow.
So, sir, you got a GMC registration on the basis of FRCS Glasgow. Am I correct?
Yeah. Yes.
Okay. So, sir, when you passed FCPS exam,
2012.
so, sir, how was your experience in preparing for the Part 2 exam and all the journey of the exam preparation? Because it's may be doing different while preparing for the foreign exam.
Yeah, absolutely. The FCPS exam is quite different. It's the only exam that will still have the long case, um, while none of the exams have long cases anymore anywhere. So I still think the long case is an odd bit in terms of an exam. But you know what I strongly believe is that if you had a good training, you can pass the exams. If you don't have a good training, then you can't pass any exam, especially the practical ones. The practical one is more dependent on how good you've been trained, or how poorly you've been trained. If you've been trained properly, then you can pass those exams. If you're not trained properly, then you will struggle in any exam, either FCPS or FRCS.
So while preparing for the FCPS exam, what tips or tricks you would like to suggest to us? Because we are going to expect this exam very soon. So, any suggestion, recommendation from your side that you wanted
So
to tell us?
the thing is, in order to pass the theory exams, you need to read the books. Okay, there's no rocket science in that. But for the practical exams, I can guarantee you that you will pass the practical exams, either FCPS Part 2 or any FRCS exams or FRC of the exams, if you've done a proper training. And by proper training means that you've seen many patients, okay? The problem in our generation, not exactly in my generation, our generation that you're talking about, unfortunately, is that we are in a rush. We want to achieve things very quickly. There is a time for everything. You have to understand that, number one. And plus, you need to work really hard for it. You just can't achieve that in a day or two. So people want to do training, for the 4-year FCPS training is actually quite low. In England, the training is about 7 years. So you want to achieve already in a short period of time. And out of these 3 years, you spend almost 6 months rotating here and there and some holidays and stuff like that. Um, and 3.5 years is not enough. And until and unless you work really hard. And many of the centers in Pakistan, they work from 9 to 1 or 9 to 2. That's not enough. How many patients you're going to see in that time? Unless and until you spend more time discussing patients with your seniors or your supervisors and stuff like that, you won't learn properly, and you won't learn the approach that they want to test you in the exams. So unfortunately, I think this is the bitter truth, unfortunately. And people who fail in the exam, they don't want to hear this truth. But you want to crack on the exam the way you crack on the MCQs and stuff. Like, you can pass MCQs. I'm not saying that. Even if you don't do 3-year training, you can still pass MCQs because you need to read the books. And lots of us are really good in reading the books. But you can't pass the theory exams unless you've got a practical exam, unless you've got a good approach. And you can only learn good approach by spending time with patients, because patients are your best teachers, and this is the way you're going to learn. So pick up good cases, discuss good cases, rather than being in a rush to go home and do lots of things. So in your residency training, this is your life. This is what you need to spend more time in. Think about the cases that you saw, discuss about the cases that you saw, and that's how this will incorporate in your mind. And that's what the approach is. And this is what typically is checked in the exam, in any exam. So once you've got a good approach, good training, you can pass all the exams very easily. But trust me, if you haven't done good training, or you've skipped your residency in any ways, um, and if you're struggling in your exam, trust me, you won't be able to pass your exam unless and until you go on and start seeing patients as much as you can. And once you've seen your patients, your exam will be a piece of cake.
Yes, sir, truly said, sir. This is a fact. And sir, after clearing your FCPC exam in 2012, when did you pass FRC's Glasgow? Which year?
I think I passed immediately after that. I think 20 something like 2013ish, sometime in 2013 I
Okay.
passed that FRC. Yeah,
So
few
within a
months
1 year.
later. Yeah,
Yeah. So, sir,
something like that. Yeah.
so, sir, there is also another option of going to the UK by the CPSP MTI initiative route. So, what is your experience regarding this? Any suggestion or any experience about that?
Yeah, that's a good route, especially if somebody. So yes, I skipped the part where I wanted to talk about the ICO fellowship and MI
MTI.
sorry,
MTI.
sorry, what do you call this program?
MTI CPSP program. MTI.
MTS. Yeah. So they both are fairly similar programs. Okay, and ICU fellowship, they also offer 1-year fellowships and 3-month fellowships. Um, so ICU 1-year fellowships, they are very good programs. So in terms of any career counseling programs, you need to first think about what your plans are. Okay, if your plan is to live in Pakistan, okay, work here, then I think ICU fellowship or the CPSP fellowship in UK is very useful.
Okay.
Because the purpose of these fellowship is to learn new things in the developed nation, and then you bring those skills back in. But if you want to leave Pakistan for some reason and you want to work abroad, then these two options are not workable.
Okay. So, sir, you did ISO fellowship after going to the UK, or you did it just before going to the UK?
No, 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 no. I did it before that. I did it before that.
Before Australia, which specialty you did it?
I did it in pediatric ophthalmology, interestingly.
Okay. So, sir, after that you went to the UK. So, sir,
Yes.
wasn't that hard to acquire first job in UK on the basis of FSS Glasgow?
So you need to understand the fact that either in UK or USA, anywhere else in the world, the job market fluctuates quite a lot. Okay, it goes like up and down, zigzag. So sometimes there is a job market and you can get into the jobs, but sometimes you don't get into the job very easily.
Okay.
But luckily, when I was applying, there were lots of jobs, but then it fluctuated afterwards. But yeah, alhamdulillah, I got the job very easily. But yeah.
So, sir, when you went there, your first job was a grade of as a senior clinical fellow or a specialist registrar?
It was a clinical fellow.
Clinical fellow. So, sir, it's a training post or non-training post? Senior clinical fellow.
No, they are not funded as clinical training posts. The only training posts are funded are senior registrar posts. So they are not funded training post, but most of the centers, they do support training as well. So you
And
might not get training in every clinical fellow post, but
okay.
most of the centers do support it. So you can get the opportunity of learning and get training in any case.
So, sir, how was your experience in UK? Because you were new in the UK system, and means to say, wasn't that hard to? Is there any struggle in adjusting that system after coming from Pakistan?
Oh yes, absolutely. There's always a struggle adjusting into that system because in this system we are not used to lots of documentation. I think that's the biggest difference. Um, and in any developed nation, once you haven't documented anything, it means that you haven't done it. And you can be in serious trouble if you haven't documented anything, even though you've seen the patient and you've looked at that sign. But if you haven't documented, it's assumed that you haven't seen it. So I think the biggest leap is doing a proper documentation. Um, and there are pathways that you need to follow, which is not the case here in Pakistan. Even even after my return, I'm struggling to make lots of pathways here.
Mm.
Uh, but in UK, they already got set up pathways. They made those pathways years ago. You have to follow those pathways. For example, if you've seen a patient with central retinal artery occlusion, um, then you have to follow a certain pathway, like doing certain tests and maybe involve the stroke team. No such pathways are taken in here, so you are absolutely um, in a limbo if you've moved from here to UK and then you don't know those pathways, and you can be in trouble if you miss those pathways because they are serious problems. So this is the issue, and this is just one example, and there are lots of things like that. Like for example, um, uh, the suspected child abuse cases or child trauma cases. They are taken very, very, very seriously in the developed nations. So there are certain pathways where you have to involve certain agencies
Mm.
if you come across even a suspected patient like that. Because suddenly lots of agencies can be involved in the support of the child. And as a doctor, this is your responsibility to be involved in those things. But no such pathways exist in Pakistan, unfortunately.
That's right.
Um, so even if you're working in pediatric ophthalmology, you might not be aware about these pathways. Unfortunately, this is very, very unfortunate. And if you're working in UK, boom, suddenly you need to be aware about all these things. Otherwise, you will be in trouble. So there are lots of examples like these where you need to get used to those pathways. Uh, and I think what's really, really important is that you need to learn to document things. Unfortunately, 90% of the trainees I see these days in Pakistan, they don't have a habit of documenting anything. Lots of negative findings are really important as well. And this is again something that we test in exams. So not every negative finding is important, but important negative findings need to be documented.
Yes, sir.
So, and again, that's a big leap.
So how many years you live in UK?
7 years.
7 years. So you also told us that you have given FRC opt exam after going in UK. So what were the circumstances or the reasons although you got the GMC registration, you got the senior clinical fellow. So what were the things that make you give FRC opt exam?
I think the biggest reason I wanted to give is because this it's quite a norm over there. So every consultant is FRCopt. Pretty much every consultant is FRCopt. Um, or consultants who are working or came from any European sites, they're FIBO. They are called FIBOs. Um, so in order to become a consultant, I think it's good to have. It's not necessary, but it's good to have FRCopt. Um, and so I started giving the exam, and yeah, and I think it's easier when you're working over there, especially the final parts, um, because you're used to the system, you're used to the ethical scenarios that they ask in the question and in the exams, the communication they ask in the exam. They are all part of your clinical practice every day. So the exams become much easier when you're working over there. So I thought, why not give the exam anyway?
So after giving the exam, sir, you went through the CSER pathway, I think.
Hmm.
You have completed the competency levels, and after that, you.
Exactly. So this is the competency path. This is the competency pathway. So in order to get the specialist register, you have two pathways. Either you go into the training program, which is called CCT, or you do an equivalence called Caesar. The benefits of Caesar is that you don't need to move around to different hospitals. You can stick in one hospital and complete all your residency trainings and competencies, and then you submit that to GMC. If they approve everything, and then they grant you the specialist register. Similarly, in training as well, you have to go through the training program. It's the same training program for both, either Caesar or CCT. You have to go through the same competencies for Caesar and CCT. The only difference is the CCT is a paid training post, and Caesar is not a paid training post. So you have to work for all your things, and in your spare time, you can get your competency signed off. and then at the end you can submit that. But on the other hand, you've got the edge because you're already when you move to UK at that level, you're already working as a consultant. Um, you already know the cataract surgery, you already know lots of things that can be much easier to grasp compared to someone who freshly started training in the ophthalmology. So yeah, that's what it is.
Sir, you told me that Caesar pathway is not a paid pathway. So means you were practicing over there as a senior clinical fellow. So they must be paying you a stipend or a salary.
No, so for senior clinical fellow, you get the same salary. So there are three grades you can say, and I'm sure anyone who's working in Pakistan might be aware about this similar three grades. So in Pakistan, the three grades are: number one is you've got trainees or residents. Okay, they get paid usually much less, and then you've got consultants. They are paid more, and then you've got RMOs or medical officers in between. They are not training. They are not trainees. So the consultants are not responsible to training them, but they are responsible to training the residents. Similarly, in UK, so they've got trainees, which are responsibility of the trainers to be trained, and then there are consultants, and then in between there are staff grade doctors, which includes clinical fellows and all these. It is expected that they should have a certain level of capabilities. So it's not expected that they will be taught on everything, but training is essential in every grade. Okay, so they will learn with time, but it is expected that they should know certain level of competencies when they were hired. So that's why their salary is in between the two as well. It's not too bad, but it's not very good either.
Okay, sir. So, how you find living in UK in comparison to Pakistan? Because we are being heard that inflation is on rise after Brexit in UK, and the atmosphere in perspective of religion and other things. So, how did you find the atmosphere, and especially in regards of keeping family in UK?
So I think again, this is a broad question, and I don't want to answer this question because I think it all depends on everyone's circumstances. Okay,
Okay,
um, you need to understand that there is no perfect place in the world. Okay, this is what it is. So there is no perfect place. There are flaws in everywhere you live in. Okay, but it's up to you. What are your priorities? Okay,
okay,
if your priorities are to earn a lot of money, then I think UK is not the place for you because you might not be able to earn a lot of money over there. Okay, they've got really heavy taxes. Yes, inflation is really high. Um, and yes, the cost of living is getting more and more. So you might not be able to save a lot in UK if you're working in UK. Even if you work for 10 years, even if you work for 20 years, you might not be able to save a lot of money. Um, and this is what the general trend is, that if you want to save more money, then I think Middle Eastern countries are a better option for you. But again, it comes to the priorities, what your priorities are. If your priority is to be working in more well equipped, well trained, more professional environment, then maybe UK is the best place for you. Um, but if your priority is to serve your local community, then you should stay here in Pakistan, because that's how you're going to serve the local community here. If your priority is your family, then you might stay here because you can't leave your family here. Um, so there are pros and cons in everything, and everyone has to customize their own needs and then decide what they want to do. Um, I think family is really, really important, and what I would strongly suggest to every one of you who is really keen to look for options here and there is that, if you have to family look after, or if you're attached with your family, then I think you should stay here. There are very, very good opportunities there. You shouldn't get disheartened with the situation or anything like that. It has always, it
yes,
always comes back and forth. There's always up and down and everything.
yeah.
You should always look at the positives. Um, I was talking to one of the really big businessmen a few days ago, and he said, Umair, the best opportunities for business are when the situation of the country or economic country is really bad, and that's when you pick up good ideas and you invest on good ideas, and then they pay you off. You don't get good opportunities on already booming economies, and that's unfortunately the gamble that you take. So if you are, don't get disheartened about lots of things that you hear here and there. As I said, there are pros and cons everywhere. Nothing is perfect, but you have to customize on your own what you want. Um, Obviously, staying with your family is more important than anything else.
So, sir, can't we take our family, for example, if there's a wife and two children, so one children and mother and father, can we take our family, our parents with us in UK, or is that not possible there?
No, I don't think so. You can take your kids and wife, but you cannot take your parents with you.
On visiting visa as well?
So the problem is, I don't know. You have to apply for the visas separately.
Okay.
Not everyone's visa gets accepted.
Mm.
Number two is, even if you get the visa, the problem is, your parents are assumed, if you were a graduate or postgraduate doctor, most of your parents are above 60, right? And this is the time when they need lots of healthcare support.
So,
So if you're in UK as a visitor, you are not supported anyways in terms of the healthcare. So either you should pay a lot of money to get travel insurance, or you might end up paying a lot of money for the healthcare if you use it. And that's a lot of money. It's
yes.
not very cheap.
Uh,
Uh, so it's not that simple. Number one, visa is difficult. Number two is, um, yeah, so you need to think about the healthcare as well. So if they stay with you for 6 months, as far as I know, you can't get more than 6 months visitors visas that easily.
okay.
Maybe there are some clauses. I don't know. I'm not aware about those visitors visas clause. But let's assume that they live with you for 6 months. But you need to be aware about the healthcare support.
Okay.
And there is a government healthcare support, which is um, you pay a certain amount of money from your salary, and that becomes free for you to some level. So if you got any problem, or your kids got problem, or your wife's got problem, then you're covered in that national health services, but to a certain level. Not everything is free. Like drugs are not free, medicine is not free, or things like that.
Okay.
But for your parents who are not or on the visitors visa, there's nothing free for them, so they have to pay for every consultation and things like that.
So what you will suggest for the young residents or young ophthalmologists after who just did the FCPS and who wanted to go to the UK? For example, in both scenarios, if anybody wanted to go UK and come after a few time, or for the others who wanted to live there and pursue the career in the UK. So what will be the appropriate plan or the strategy for both of them?
So if again, as I said, you have to customize your needs. You need to look into your family and everything else. Okay. So if you got a family to look after, and if you think you can't leave your family, then my strong recommendation would be that you stay here. Okay. Because the sooner you start developing your practice, the better it will be with a period of time. And if you're thinking about going to UK for a couple of months and then coming back, then I think you won't you will have a very bad lag in terms of your practice development. Okay, so you better start your practice as soon as you do your part two. So your practice is established after 3-4 years reasonably well. Um, and you're settled in terms of that. But instead of wasting a lot of time here and there, and then you settle after 5 years, then you've wasted 5 years in development of your practice. So I think that's really important, that you understand what your needs are, customize yourself. And if you needed your family, or if your family needs you, or you need your family and things like that, then I think it's better you stay here. You can always do these type of small fellowships, like ICU fellowship. ICU got a 6 month fellowship, ICU got 1 year fellowship, ICU got 3 month fellowship, and that's a very good opportunity for you to learn better skills from developing nations. So you can always apply that. You can always go for that. And you can always achieve the CPSP fellowship. You can also do that at 1 year, and then you can just go there and learn a few things and come back. In this way, your practice is not too much disturbed, and then you continue with your practice, and your practice establishment is easier. But if you wanna go to UK, if your aims are to go to UK, you got two pathways. Either you don't do residency here and you apply for um, you go for PLAB pathway, and then you do your PLAB and then start working over there as an SHO, and then pursue the training program over there. The other pathway would be after doing the FRCS. If you've done the FRCS, then only you can get the GMC registration. I still believe the FRC Opt exam. You can do FRC Opt exam if you want to. Now they've started few components in Pakistan as well, but still you have to go for last few exams to other centers, not in Pakistan at the moment. Um, so this is doable now, but you can always do FRCS. In either way, you can get the GMC registration, and you can go to UK. And most likely in that pathway, it's very difficult for you to go into the training program because you've already spent quite a lot of time in your training. So you can only do Caesar. Most of you, it's not truly only. You can still go to the training program, but it's very difficult. But it's easier for you to pursue the Caesar pathway and then achieve a specialist registration and work as a consultant.
So just ask about the Middle East pathway for a young ophthalmologist. What you recommend? Should it be adopted, or if it won't be adopted? Like if anybody want to come after 10 years or 15 years back to Pakistan or like this, how you feel Middle East pathway like UAE and other Arabian countries in career pathway?
I think again it comes to the point that what your priorities are. Okay, mainly the purpose of people working in Middle East is to have better savings, which makes more sense because most of these Middle Eastern countries offer you tax-free salary. So I think that's the main reason. And um, yeah, what I've heard from people who've worked for many years in Middle East that they've got really handsome savings. So this is something if you're looking for save, I guess this is a quicker option relatively um, than anywhere else. As
So,
you said it yourself at the beginning, which I agree to some extent that unfortunately the inflation has hit really bad in Europe, even in Canada and all these places. Not so much in Pakistan, to be honest, but really bad in the Western areas. So the savings are even more difficult for people working over there. But yeah, for Middle Eastern areas, this is a good opportunity. In terms of when you plan to come back after 10 years or 12 years, again, it depends on the situation and what sort of work you want to do after that. Um, I know people who worked for 10, 15 years and if they're turned back after 10, 15 years. Again, what's really important is even if you're working anywhere in developing nations, if you just plan to work the way you are, um, without trying to improve your skills, without trying to improve your knowledge, without trying to improve your skills anywhere, then it gets more and more difficult for you to get jobs or opportunities after a few years and down the line because you're not gaining anything new or you're not getting anything new, more innovative skills in your life to offer. So even if you're working in Middle East, if you try to improve your skills, if you try to improve your knowledge, if you try to improve or offer something innovative to the employer, then I think there are all lots of opportunities for you. So the people I'm talking about, they actually improve their skills, they actually improve their knowledge, they actually improve their CVs. So when they were back, they had very good opportunities. Um, so it all depends on how you take on. If your plan is to just earn money and just be happy with what you're doing it, then you might have a trouble after 10, 15 years. But if you focus on your skills, improving your skills, then I think you might be in a better position after 10 years.
so sir, my last question is, after FCPS, what are the other options, or what options will you recommend to the young ophthalmologist after FCPS? Should we go abroad, like UK and other things, and what option do we have then in this context? Or if we are if we want to live in Pakistan, but to upgrade our skills, and which fellowship or which pathway should we adopt?
I would strongly, very strongly encourage you or any new FCPS trainees who are about to finish their trainees to try and establish your practices in Pakistan, okay? Because people need here good ophthalmologists, okay? I come across cases where they were malmanaged every day, every day. So it means that there is a demand for good ophthalmologists everywhere. So I think it's really important that you try and establish your practices here. Especially in the rural areas, and I know you belong from Hyderabad, and just rural to the Hyderabad. There's a lot of population that need good ophthalmologists. They don't need to travel. Many of my patients travel like 500 miles, 600 miles just to get their cataracts done, which is not fair. You should be available for them to have their cataracts removed. And there is like a massive potential to establish practices around those areas, which you can easily can. Um, so focus on these things. But in order to improve the learning, this is a very different era. I still say this to everyone. People used to learn things from books 15 years ago, but now there are other resources for you to train you better and teach you better, like lots of podcast, webinars, YouTube channels, and lots of resources that you have now. They can train you in such a well way than books used to do it before. So I think the distance have shrunk significantly, and plus you got these opportunities where you always can go and work over there. One of my colleagues, he's a very senior guy, and he spent like a few weeks. He spent his money all the way to just go and observe um, one of the consultant in Manchester for a few weeks. That's it. Just to improve his skills, just to improve his knowledge. He had a very good practice already, but he thought, maybe I'll serve better if I get more innovative things and more up to date things. So he spent his money and went there and learned a lot of things. So I think So there are lots of opportunities you have, and in terms of saving that as well, I'm sure you guys know better than I do. Lots of people practicing here and there. They've got really massive practices, and I'm sure they've got really good savings as well. So in terms of savings, you don't need to worry too much about it if you've established your practices here.
But no, in my perspective, what our few colleagues were planning, like they wanted to do FCPS from Pakistan, then they wanted to spend few years in the UK, then some time in the Middle East to uh, get some saving to build up their own setup in Pakistan. Then they wanted to come back to Pakistan to build their own setup. So how did you find this strategy? Is that reasonable, or should we start directly after FCPS? We start our own practice in Pakistan instead of investing and going there?
I personally think that this is not workable, to be honest. Lots of people plan this way, and as I said, only what happens is what Allah has planned for you. And I think if your will is to serve the needy people around here, then um, lots of goodness comes automatically in it. So don't be so stepwise in terms of planning all these things. Trust me, it doesn't work that way. It never happens this way. And the pathway you're telling me is not something that I've come across. Many people have done it, just maybe hardly few. So if it's so doable, then lots of people might have done it so far, but unfortunately, very few have done it. So it's not a doable option in my opinion. So either focus here or there. And again, what's really important is to prioritize what's really important for you in life.
So for example, if anybody wanted to do practice in Pakistan, so in regards of subspecialty training, like CPSP offers some subspecialty training in Pakistan as well, but the fellowship of subspecialties in abroad is much valuable. And so if anybody do this is an era of subspecialty, so what you recommend in this regard? Should we do it here or should we go abroad for that? And then which country should you recommend?
No, I think if you come across vitreoretina subspecialty, which has been recognized by CPSP for many years now, and you can come across lots of fantastic vitreoretina surgeons here. So this is unfair to say that it's not recognized. But and similarly, we are working really hard to get the glaucoma fellowship recognized as well soon, inshallah. Um, but as I said, there are opportunities for you to go and learn. I'm not discouraging you, I'm encouraging you to go and learn those opportunities and achieve those opportunities and maybe learn some more innovative stuff. But I think the priority would be, which I want you to encourage, which I encourage you to do, is to focus and build your practices here, and especially lots of rural areas which need you, and you can build massive practices over there.
Fine. So thank you for your time. You give a change our perspective in regards of our future in career counseling and planning. Surely our young people will follow this and pursue this career. So indeed, the main thing is to serve the humanity. Being a doctor, that was our only goal, to serve the humanity, and to serve this purpose, we have to take some initiatives as well. As my previous supervisor was one of the example. He did a first year from UK, then he came back and is still serving in Pakistan, and you also did the same thing. So this is a legacy that you are giving to us, and inshallah we will try our best to follow this legacy. So thanks a lot for your time. So any last remarks or suggestion you would like to suggest us?
No, thank you so much. And just, I think, just try and do what's best for you, for your family, and for your community. And always think that if you have a skill or knowledge, then it's for you to provide the skill and knowledge to others as well. It's a responsibility for you to provide that skill and help people who can get used to that, get benefit out of that skill as well. So it's really important that the skill that you have, the knowledge that you have, is beneficial for lots of people around you rather than just yourself. So be mindful about that. Okay.
Yeah, yes, sir. So thanks a lot for your time. Thank you.
Thank you.
Thank
Thank
you.
you.
Thank you.